So what are my treatment options for sleep apnea?
So once we diagnose you with sleep apnea, we sit down with you and discuss various treatment options. The gold standard for the treatment of sleep apnea is using a CPAP machine. CPAP machine is a small device, size of a radio, which is basically an air compressor device which takes the room air and produces at higher pressure. We then use one of these masks to provide you with this pressure, either a full face mask like this or something which is much easier and less obtrusive, and sometimes it's help patient with watching TV or reading book, which is their habit when they're trying to fall asleep. Patient who fails the trial of CPAP, we switch them to BiPAP. If they cannot tolerate BiPAP, the next best option is to use a mouth guard. A mouth guard is a dental device which moves your lower jaw forward, and by moving that, it opens your posterior airway, and that in some patients helps with the snoring and sleep apnea. The latest treatment that came out is Inspire. In Inspire, there is a small pacemaker which is put under your right chest wall, and there are two wires that comes out of it. One of them goes to your fourth rib and other goes to the base of your tongue. Every time when you breathe in, it sends a very, very light signal to the base of your tongue and contracts your tongue and thus open the airway. However, you have to fail the trial of CPAP in order to qualify for the Inspire treatment. The fourth option is, of course, UPP surgery, in which what the ENT surgeon go in and they do uvuloplasty and pharyngoplasty. That means they take your tonsils out and cut piece of your uvula, and that sometimes open the airway. However, the success rate is less than 50%, so we don't recommend that as the first line of treatment. And of course, with all these treatments, the best option is the weight loss.